Hi, I'm Milan Thomas, Consultant Urological Surgeon. I'm Clinical Lead for the Urology Department at East Kent Hospitals and Lead Specialist for Kidney Cancer at the Trust. I work at Ashford Hospital and offer most urological services that patients require. So bladder cancer is a common disease, and unfortunately it's one of the top 10 cancers in the world and affects men more commonly than women. It presents with blood in the urine commonly, and thankfully most people who present with bladder cancer have lower risk cancer that can be treated with minimally invasive treatments. Blood in the urine is the commonest symptom, and that occurs in more than 90% of patients who have bladder cancers. And thankfully, because most of the cancers that present are low risk and non-invasive, we can treat most of those with a very simple procedure, passing a camera into the bladder. In some cases though, and that's a smaller percentage thankfully, more invasive treatment is required. Most bladder cancers are low risk, and therefore we would perform a procedure called a transurethral resection of a bladder tumour. And that is a camera that passes into the water pipe and scrapes away the tumour. And in the majority of cases, thankfully, that will cure the tumour. But sometimes they come back, and therefore we perform ongoing screening to ensure that we pick these up early. Unfortunately, some patients have more aggressive disease, which means that the tumour invades into the deeper parts of the bladder. And in that situation, we either need to remove the bladder or perform radiotherapy with chemotherapy. Thankfully, as most bladder tumours are low risk, then the outcome is excellent. We would treat the tumour with a TURBT, or the transurethral resection of the bladder tumour, and then it's a case of monitoring it with cystoscopies, which is a simple camera procedure which goes into the bladder. For patients who fit into that category, the outcomes are excellent, and we see long-term survivals which are, above 90%. For the patients who require more invasive surgery, that is almost a different disease. Even with that, we can still expect good outcomes, and the emphasis is on early diagnosis. The sooner you present, the more likely you are to have a curative procedure, either by chemotherapy and radiotherapy or removal of the bladder via a cystectomy. So in summary, if you have any concerns, or more importantly, if you see blood in the urine, then I would not delay seeking medical attention and seeing a urologist urgently. Blood in the urine can be either blood that you see in the urine yourself, or blood that's picked up on a urine dipstick analysis, at which point your GP would ask you to see a urologist urgently. We are more than happy to see you on an urgent basis at Ashford Hospital, where we have the facilities to diagnose and treat most bladder cancers.